You may have heard of blepharitis. You have almost certainly heard of dry eye, but what is the relationship between the two? In this episode of OCuTALK, optometrist Monvelea Makor will be discussing the ways that inflammation can lead to dry eye, the effects when makeup is involved, and some of the simple treatment options available. Dr. Makor?
I want to talk to you.
Not now, later.
No, now.
Hello, everyone, and welcome to OCuTALK. Today, we're going to be talking with Dr. Monvelea Makor, or also Dr. Mully, who is an optometrist out of San Diego, California. Dr. Mully, how are you?
Hi, how are you doing?
Oh, I'm doing fantastic, You know, when we start this show, we always like to talk a little bit about the doctor and their specialty, sort of what got them into the field in the first place. So why don't we start there and just give the audience a little introduction to yourself.
Yeah, well, my name is Dr. Makor, and I am from the San Diego County area where I practice here in California. And my focus is primary eye care.
Very good. Well, I'll tell you, so the subject today is around blepharitis, and this is something we've talked about on the channel a lot, but today we're specifically want to talk about blepharitis and how it relates to dry eye. But I think even though we've talked about this several times, I think it's always good to start out at the top by just explaining what is blepharitis first and foremost.
Well, blepharitis is the inflammation of the eyelid, primarily the eyelid margin.
Are there different types of blepharitis?
Yes, so there's actually three different types of blepharitis. You have the anterior blepharitis, which is the outer lid. And then you also have posterior, which is the inner lid, as well as the meibomian gland. Now you can also have a mix of the two, which is the anterior blepharitis as well as posterior.
So when we're talking about the inner lid, are we talking about the part that can't be seen from the front? Is that what we're talking about?
Yes.
Oh, okay. And what causes blepharitis? Well, and maybe we could expand that a little bit and say, is blepharitis a disease state by itself, or is it sort of a sign of other things? What causes it to begin with?
That blepharitis, there's many things that can cause it. What I mainly see in my office is like bacterial overgrowth at the lid margin. I also see maybe just poor eyelid hygiene, honestly, like just people not cleaning their lids. Just like you have a skin routine, you should clean your lids. Just like you brush your teeth, you should clean your lids. And that's just not something that people are very mindful of doing, I've noticed. So that's honestly, poor lid hygiene is the main thing, but
How common is blepharitis in general? You said you see it a lot in your practice, and you say that the most common that you see is bacterial. Is that the most common overall, or is that just what you happen to see the most in your practice?
Well, the most common blepharitis is anterior. So I would say bacterial is probably the most common just because we naturally have bacteria on our lids and lashes. Now, our overgrowth of it can lead to blepharitis, the inflammation of the lid.
So when you say that you're seeing it in your practice, what is it that you're seeing? What are the signs, if you will, or symptoms that can indicate blepharitis?
So sometimes I see patients with like inflamed or just eyelid swelling. I also see redness of the eye. Sometimes I see patients complaining about itchiness. But those are the most common complaints that I see, as well as what I see. Yeah.
So is there anything that we can do to avoid this in terms of, we're seeing it very common, and again, you're talking about there's lots of different types, but what is it that I could do to possibly avoid getting blepharitis in the first place?
Well, I would say the primary thing is just eyelid hygiene. Clean your lids. It's simple, but it's something that a lot of people are not mindful again of doing. So cleaning your eyelids, have a routine in place for that. Try not to rub your eyes too much. And fortunately there's products out there. So use hypoallergenic products around your eyes, especially if you're experiencing that inflammation of the lids.
So let's expand on that a little bit, and I think possibly one of the reasons why maybe people don't pay as much attention to eyelid hygiene, maybe before today, that may be the first time they've ever heard that term before, right? What does it mean to clean your eyelids, right? Because I know a lot of times when you're, even if you're washing your face, you're doing this, right? Like trying very specifically to avoid the eyes, right? So what does cleaning your eyelids look like?
So ways to clean your lids, you have warm compresses, which you can use, which is something that's very accessible to the most of the population. To narrow it in, we also have lid scrubs that can be used. And those lid scrubs, fortunately, there's a lot of companies out there that have products out there that at drugstores that you can readily get that. But with the lid scrubs itself, you just gently just rub your lids. So after you shower, just be mindful of, hey, I'm doing my face routine, and just include your eyelid in that face routine. So with the lid scrubs, you gently rub those eyes, gently,
Yeah.
ever so gently, just to remove bacteria. Mhm.
I think that's a good point too, because part of the reason why when you're normally washing your face with, say, face soap or something, the reason you're doing this is because it can be very uncomfortable. And there are lots of different products that don't have that problem, right? They're specifically made to not be irritating to the eye, so that you can get in there and actually do some scrubbing, right? Would you agree with that statement?
Yes.
So, are there anything that you do in the office? But we're kind of talking about your at-home regimen. Is there anything that you, as a doctor, would do in the office to treat blepharitis?
Oh, there's so many things. So depending on how the severity, on the more conservative end, we can do just in office, like just gently scrub the lids. We can do that by doing just like a blepharitis scrub. We can do meibomian gland expressions. We can use topicals as well, and more advanced treatments such as we can do the lipoflow, which kind of warm up those glands and expel that oil from the glands. And we can also do IPL, which is the internal pulse light. Mhm.
That's very interesting. In fact, I think you touched on something here, which is part of the reason we wanted to talk today. Is we've talked about blepharitis, right? That we're talking about the redness, possibly some bacterial involvement, but how does that relate to dry eye? Specifically, right? Like obviously, if your eyes are irritated, it could contribute to that. But what is the relationship between blepharitis and dry eye?
So just keep in mind that if you have inflammation of the eyelid itself, um, the eyelid is in close proximity to your conjunctiva, which can cause inflammation of your conjunctivitis, as well as inflammation of your cornea itself, which is keratitis. So it's just pretty much like a domino effect that you can have if you're not treating the root cause, which is the blepharitis itself. And that can lead, because of all those inflammation, that can lead to dry eye syndrome. It can also lead to other vision problems as well, but dry eye itself, it'll lead to dry eyes just because the inflammation there, your tear film is not at homeostasis. In other words, that oil is not being produced, it's not functioning like it should because of the blepharitis.
Well, so let's expand on that a little bit, right? You talked a little bit about meibomian glands, and we've talked about this on the channel before. As a reminder, right, these are the glands along the lid margin that are producing oil to kind of seal in the moisture, if you will, right? So how does that relate to blepharitis? Because we've talked about it a little bit. In fact, one of the in-office treatments you talked about was expression, right? And that's specifically for meibomian glands. So how is the blepharitis contributing to these MGD issues or other meibomian gland issues that you can have? Is it just the inflammation itself that's causing the problem, or are there other underlying things?
It can be other underlying things. So people with dermatological issues, such as like rosacea, people with severe allergies, all of that can play a role in causing the meibomian gland not to produce the oil that needs to be produced, and then that can be clogged. And that itself can lead to, which is blepharitis itself, it's just posterior, which can lead to that blepharitis, which can lead to other problems, visual problems.
So is blepharitis, is this something that we have a cure for, right? Are there long-term treatment options? Can it be cured? Or is this something that somebody might deal with for a really long time?
Unfortunately, it's not something that can be cured. However, it can be managed and controlled. That's why having a good eyelid hygiene or routine in place will help keep that bacterial overgrowth at a minimum.
Well, and I think you've touched on this throughout our conversation here, right? But what happens if my blepharitis goes untreated, right? Maybe somebody thinks, hey, my eyelids are a little red, or maybe they're irritated because it's allergy season. Maybe there's just some pollen in my eye. But what happens if I ignore this, right? And I say I'm going to deal with it on my own. What are some of the side effects that might come from that?
Again, dry eyes. Severe dry eye syndrome is one of the side effects. Other inflammation of the cornea, inflammation of the conjunctiva.
Nothing good, huh?
Nothing good. Nothing good can come from it. It's just like your eyes are inflamed. It's just you're not happy. It's hard to do work. It's hard, especially now these days. We're on a computer all the time.
So what about, are there certain people that are more prone to blepharitis? Is it a genetic thing, or is it an environmental thing, or a combination of both?
A combination of both. Allergies play a major role. Honestly, the primary thing, again, like I said before, is poor lid hygiene.
Okay, because this is a specific question that I had here. So can somebody with blepharitis continue to wear makeup?
I mean, as a woman,
Right.
wearing makeup, I would say just wear it as a minimum. And if
Right.
you, again, have a good eyelid hygiene in place, it's hard to get my patients that are so loyal to wearing their makeup, get them out the makeup. So I try to either have some kind of routine in place or what to do when they remove their makeup. And I feel that helps, but just wear makeup at a minimum. I would say just at a minimum. If you don't have to wear it, don't wear it. Like there's days, for example, I'm not wearing any eye makeup right now, but I'm like, let me spruce it up and put lipstick on to balance it out. Like there's ways, alternatives. If you do wear like liner, just don't hit the waterline.
That was a question I was going to ask. So we do a lot of experimentation here in terms of makeup removers and things. So I'm actually very familiar with eye makeup. Is a pencil better than, say, some of those liquid eyeliners if you have blepharitis, or are they both going to be equally as problematic? Should I just avoid eyeliners in general? Because if you think about it, right, specifically around eyeliners, right, this is exactly the area that we're talking about.
Yeah. That's a good question. I would say just avoid the waterline, honestly. I'm not going to say if each one has this pros and cons.
Right.
So the biggest thing is just to avoid the waterline. And when you do remove that makeup, just make sure you're using the right products. And I would recommend following up with some kind of scrub just to make sure you're removing all those irritants that's just built up there.
Is that, do you think that that's something that contributes, right? Like, I mean, I'm sure, like, my wife tells me this all the time, right? Like, it shouldn't be sleeping in your makeup, right? But it happens, right? It happens from time to time, and especially with eye makeup. Is that something that's contributing to it? And fellas out there, right, they may not realize it. It's not an easy task exactly to get all of this off, right? Especially around the eye area. Is that something that contributes to it? Like maybe just not getting everything off of there? Is that something that contributes?
Yes.
Really?
Yes. Because it's an irritant. And so it's just like you have all that, you have the makeup there, and then you'll start having that bacterial growing in that makeup. And then it's just like an explosion. There goes the inflammation.
we talked a lot about eye makeup, but this is not a female problem, right? Like men get blepharitis too, and if you think about it, like maybe even more so, I don't know, because you're touching your eyes and you got funk on your hands or whatever, right? It can happen, especially when you're talking about these bacterial, right? Like in a lot of cases, I'm imagining they didn't just get there; they came from something. Like you maybe touched your eye, or we talked about makeup, but this is not just a female problem. Men absolutely have blepharitis. It absolutely causes dry eye for them as well, and so everybody, right, needs to be cleaning their eyelids.
And from your kids, everybody, just especially your kids, clean those lids.
All right, folks. Well, you heard it here. Dr. Mully says clean your eyelids. It is very important. And if you want to avoid blepharitis, or even if you want to work on treating blepharitis, and if you're in the San Diego area and obviously having problems, give Dr. Mully a call and see what she has to say. But other than that, Dr. Mully, thank you so much. This was a very interesting conversation.
Welcome. Thank you. I appreciate it.